Did you know that the clitoris is actually very similar to the penis in men? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to talk about 5 things I'm sure you didn't know about female genitalia. If you're new here, I create urologic and sexual health content, so if you enjoy what you're hearing, be sure to subscribe and share this channel with your friends. So, the first thing you may not know is that the clitoris is comparable to the penis. In fact, they are what we call homologous structures, meaning that during early development in the womb, the clitoris and the penis start out as the very same tissue. As the fetus develops into female or male, that tissue becomes either a clitoris or a penis. They share many of the same features, including structures called corpora cavernosa, which fill with blood and expand during arousal, increasing in size. For many years, it was believed that the clitoris had around 8,000 nerve fibers. However, a more recent study from Oregon Health and Science University examined clitoral tissue under a microscope and found that it contains an average of about 10,000 nerve fibers. This means it is extremely sensitive and may be the only organ known to exist solely for the purpose of pleasure. That brings us to number 2. The clitoris has its own protective covering. This is known as the clitoral hood, or prepuce, and its role is to shield the clitoris from irritation or infection. It is very similar to the foreskin of the penis. At times, this clitoral hood can become inflamed due to a buildup of oils or dead skin cells, which may lead to discomfort, pain, or even small adhesions between the clitoris and the hood. This is somewhat similar to what is called smegma in men, which can cause discomfort and make erections or pleasure more difficult. In women, this condition may sometimes cause no noticeable symptoms, but in other cases, it can lead to pain around the clitoris, sensitivity when it is touched, or difficulty reaching orgasm in some patients. For those who experience these concerns, there is a simple in-office procedure called clitoral adhesiolysis that can help separate the clitoral glands from the hood. While this area hasn't been extensively researched, one study involving 41 women showed encouraging results. About 76% reported less pain, and 63% noticed better sexual arousal. Overall, most participants felt more satisfied with their sexual experience after the procedure and were happy with their choice to have it done. Number 3. The labia minora, or the inner lips of the vagina, can look very different from one person to another. These inner lips are much like fingerprints. They come in a wide range of shapes, colors, sizes, and thicknesses, and each one is unique to the individual. Not everyone looks the same. In fact, many images seen in pornography are digitally altered to create a certain appearance. It's completely normal for some women to have labia minora that extend beyond the outer lips, or to have asymmetry, where one side is longer or fuller than the other. Interestingly, during arousal, the labia minora can enlarge to 2 or even 3 times their usual size. They may also change color, often shifting from a lighter pink shade to a deeper red tone just before orgasm. The good news is that all of these changes are temporary, and everything returns to its usual state after sexual activity. Number 4. The vagina expands in both width and length when preparing for intercourse. The vaginal walls communicate with the brain, signaling that the body is getting ready. As a result, the body begins to produce natural lubrication, and the vagina increases in size. When not aroused, the vagina is typically about 3 to 4 centimeters wide and around 8 to 9 centimeters in length. However, this can expand to nearly twice its original size to comfortably accommodate an erect penis. And after intercourse, it returns back to its normal state. So, there is no such thing as a loose vagina caused by sex. The body is incredibly flexible and designed to adjust as needed. And finally, the vagina is self-cleaning and maintains its own healthy bacteria. The vaginal environment is naturally protective. Because of estrogen, it typically stays slightly acidic, which helps keep things balanced. It also contains beneficial bacteria that support a healthy microbiome, helping to prevent infections and stopping harmful bacteria from entering. If you are dealing with frequent yeast infections, bacterial infections, or repeated urinary tract infections, it can be a sign that something is off with the microbiome. In many cases, a simple and effective way to help prevent recurring UTIs is the use of vaginal estrogen, especially for women who produce less estrogen, such as those who are postmenopausal, have had certain surgeries, or are taking medications that lower estrogen levels. It's also very important not to clean inside the vagina, as it naturally takes care of itself. Practices like douching are not recommended. If you want to stay clean, gently use soapy water on the outside only, focusing on areas with hair. The vagina will manage its own internal balance. It doesn't need to smell like flowers, roses, vanilla, or candy. It has its own natural scent, and that is completely normal. All right, everyone. I hope you found this helpful. As always, remember to take good care of yourself because you truly deserve it.